Okay, so now that everybody, we hope is well fed and relaxed, we're going to start the show. So at first we'd like to introduce our Independent Practice Division president, current president, and who is also running for president in the upcoming year in 2015, Dr. Frank Corigliano.
Hi, my name is Dr. Frank Corigliano. I'm a clinical psychologist, and I am the current president of the Independent Practice Division. One of my passions is psychology. Another sort of interest and passion is technology. So for me, I really like working with individuals and institutions to leverage technology to address clinical and social issues. So out of that comes this interest in telepsychology. How can it solve some of the problems we're facing, such as integrated healthcare, access to care, changing practices, changing practice styles. How can we sort of leverage technology to address all these things and really build the practice of our dreams and move forward with psychology in a way that's really meaningful and innovative and sustainable and leading. So I am just so excited to see so many people here. We even filled up the overflow table. With that, we're going to have a panel discussion. We're going to first hear from Dan Stewart, Commissioner Dan Stewart, who is at Cisco, and he'll tell you a little bit about himself and some of the work that's being done on a national and global level.
What's Cisco?
Cisco? What's Cisco?
Technology.
Technology company.
And make routers and things like that.
Yep. And I've collaborated with them, and the Society has collaborated with them on several projects that we'll talk a little bit about. I also want to let you know that I am a member of the New York Society for Ethical Culture. So where you are now is the New York Society for Ethical Culture. This is our building, this is our home. And it's a faith-based religious and educational organization where the faith is in deed above creed, so doing good now to create a more ethical society. And so those are part of our missions, and we've been I've been increasingly able to overlap the two worlds of psychology and the ethical society. Clinical has had events here, IPD is having an event here. The White Institute had a huge event here last weekend. So there are a lot of very interesting overlaps. And we'll talk more about that later. We also have, Lenny, did you want to say hello now? Okay, so I also want to introduce you to our president-elect, the 2015 NYSPA president, Dr. Lenny Davidman.
Good morning, everybody. I'm actually visiting because my synagogue is a few blocks from here, so I'm actually ran out of shul to come here to greet people. Who's a member of NYSPA? Who's a member of NYSPA? Almost everybody. Okay, I'm leaving. Starting January 1st, I take office as president, but I came here mainly, thank you, I came here to really acknowledge IPD and acknowledge the leadership of IPD and acknowledge all of you, because I'm looking around the room. In this room are past presidents of NYSPA, future presidents of divisions, regions. There are a lot of presidents here. It's a joke about that. I won't tell it because I want to get this conference going. But I wanted to really acknowledge Frank, your board, and all the people behind the scenes working to make this happen. I'm very proud of IPD. I've been a member for many, many years. I can never get to the Thursday night meetings, but I'm a member for many, many years, and I love IPD. So you're going to have a great conference today. Frank is really a visionary, young and energetic, and your division, one of the largest divisions in this, but I don't know if it's the largest, one of the largest. I want you to, when you leave here, after you learn about telepsychology and telepsychiatry and telemedicine, I want you to go to your friends who are not members of NYSPA and say, join NYSPA, because why? NYSPA really is committed to private practitioners. I work in a hospital, but I've been upstate, I've been to the west part of the state. People in private practice are hurting, they're frightened, they're scared, they really want to know what's happening. And I know NYSPA is your connection to your future and to your practice. You need someone to represent you. We want to do that. So bring your friends. We need their dues money to do things also. So when you leave here, tell your friend to join NYSPA. It's not so bad as you heard. It's okay. I'm on. No, I want you people to actually email me and tell me what you need. We're here to serve you. I'm a union president. My job is to take care of psychologists. So if I become president, when I become president of NYSPA, my job is not to be political, but to take care of psychologists. That's my mission. That's what I love doing. And I just wish you a great conference. And Frank, thank you. Good luck.
Thank you, Dr. Davidman. I'd also like to welcome all the folks who could not be here today in person, but who are here through live streaming. So welcome. We wanted to make this conference available statewide, and by doing that, we actually made it available worldwide. So we're live streaming up here, we're video recording here, we're live streaming over there. So if you're here, know that you're being streamed, you're being recorded. There might be a little tweeting over here. I mean, who knows what kind of shenanigans. Yeah, and that you give permission that that's okay. If you ate the lox, you're online. And I know you ate the lox because they're gone. You wiped them out. So with that, I'm really very pleased, and I think everyone's ready to start with the panel. We'll have a couple of sort of formal presentations and then lots of Q&As. Everyone has index cards on your table. If you have questions, write down a question you want the answer to. Write down a problem that you think telepsychology might be the solution to. And write down maybe what you're doing now with telepsychology. Like, what are you doing? Those are things that are wonderful, and we'll kind of collect them, or you can hold them up, and we'll gather some of them. Some of them we'll have time to address specifically, and if not, we'll follow up. So wonderful. So with that, I want to give a very warm welcome to Dan Stewart, who is, what's your title at Cisco? Head Big Cheese, super cool guy.
Senior Justice Advisor.
Senior Justice Advisor. And he was the co-commissioner of corrections, which is the civilian body that oversees all jails, prisons, and lockups, and looks for the looks after the health and mental health of those folks. And now he wants the mic, so I'm done.
Thank you. Good morning, everybody. Or afternoon. Good afternoon. He'll always be Frank to me. I knew him before he had doctor and PhD and a lot of other stuff next to him, okay? And so he'll always be Frankie. So as Frank said, I'm the former chairman of the State Commission of Corrections in New York. And we had the oversight of Rikers Island, the 67 state prisons, 57 county jails, and the juvenile justice system in the state of New York. Prior to that, I was the mayor of Plattsburgh. Anybody know where Plattsburgh is? Yeah. I was the mayor of Plattsburgh back in the day. And I had 3 terms as mayor before I took over that. I left government in 2011. And went to work for Cisco Systems. Actually, for a short period of time, I went to work for a correctional healthcare company. And during my time on the commission, one of the things I was very interested in was how do we deliver healthcare in as many forms to the inmate population. If you were to go out to Rikers Island today, what percentage do you think of the people on Rikers Island have a mental health issue? Anybody?
100%.
I agree 100%. How many with something that could be addressed while they're incarcerated? What's the typical average? Any guesses? 30 to 40%. How many actually get the delivery necessary?
1%.
It's extremely low, extremely low. So one of the interesting things we learned as we were going along looking at this was how do we deliver it? How do we deliver it safely, securely? We're streaming right now on video. Everybody knows we're streaming, right? Everybody know what streaming is? We're live. We're live going across the World Wide Web right now. Everybody in the world can see us. And there might be someone out there that if we were doing this in a very private way, would want to actually steal this video and scrape this video. It's called scraping. What we don't want to do is be in a business where people scrape our video, and we're talking to who? Our patients, right? So one of the most important things you have to look at when you venture into this world of technology, how many had Target cards when they got hacked? Who has JP Morgan Chase? All these companies, right? Every time we use a credit card, we subject ourselves to a hacking. We subject ourselves to the hackers of the world who are trying to steal information. But also in sensitive areas, military, and even in medical, there are times that someone may want to steal that information. Maybe if one of your patients is someone of prominence of some sort. The last thing you need is to have your practice hacked into in any way, and that video showing up on YouTube tomorrow or on TMZ or some kind of show like that. Last week I was in Jacksonville, Florida. I live in Orlando, Florida. I escaped the taxes in New York. I wised up and left and went to Orlando where there are no state taxes. And I was in Jacksonville and they asked for a presentation from our company. So when Cisco came up, it was routers, switches, and that's true. And we are the plumbers of the internet. We are the ones that give the pipe in which all of you get to talk to each other. We live stream today. Every time you get on your computer to look at your email, you are probably going through us at some point. I think about 62% of the world runs on us. So in Jacksonville, they called us in and said, hey, what do you have that we can address for, number one, our jail, because we need to reduce our transports. You know, telemedicine, telehealth, telepsychiatry, telepsychology, this is big business. And it's not a business of tomorrow, it's a business of today. This is what's happening today already. So government is looking for answers. Government is looking for people who are going to supply the necessary piece in order to save them money. And how do they do that? Jacksonville says, please come in and give us a plan on how, number one, we can address our correctional institution to reduce the amount of transports of our inmates going from the jail to the hospital. Number two, employee assistance program. How do we put locations into our city government buildings where an employee can go to have psychology, psychiatric interviews, and healthcare? This is what they're doing. They want less time lost out of work. If an employee in a large building can go downstairs at 10 o'clock because they have a set appointment to talk to their psychologist, and can do a session for an hour and then walk back upstairs and be back to work, you have just given an efficiency to government where they don't have to take the day off, they don't have to leave and you backfill them with someone on overtime. You know, these are the issues of government. The less that you have to have 2 officers to every inmate transporting them across the city to go see somebody, or in the case of Putnam County, New York, everybody know what Putnam is? A little north of here? Well, Putnam County, one of the issues they had was in the jail. Let's see, has anybody here ever been arrested? You're not going to put your hand up anyway. I have. I've been arrested. All right? And when you get dragged in at 2 a.m. on Saturday morning, let's say, after having a DWI. Now, I'm not saying I did that. Okay, I did that. I had a DWI on a bicycle. All right, in 1982. I had a DWI on a bike on an Air Force base in South Dakota. All right? So, yeah, it's a long story. So, it actually is not. It's pretty cut and dry, isn't it? So, let's say Joe Q. Public or Susie Q. Public just got pulled over, and it's 2 a.m. on Saturday, and the officer says, let's do the test. They do the test, they fail the test. You bring them into the jail, all right? You get them arraigned, you bring them to the jail. Now you have to classify them into the jail. It's called the classification process. During that process, they have to ask you, do you feel like you're going to hurt yourself? Well, someone half lit, off the cuff may say, I want to kill myself. Are you crazy? This is going to kill my reputation. It's done. It's done. In the state of New York, you have just placed that person on a 24/7 one-on-one psychiatric watch. 24/7 until they see someone because they threatened to kill themselves. In Putnam County, this was an issue. Their psychiatric services were out of New York City, and that person drove up every week to go to the jail. So now it would cost them, well, let's say it was 2 a.m. on Saturday until Monday sometime, 24/7 overtime cost of one officer one-on-one watching that person. So it's money. It's big money. I probably average about 160,000 miles a year in the air. I am going to leave here today to fly to Seattle. I am going to land in Seattle, have dinner with the mayor, and fly back tomorrow morning at 7 a.m. And I'll be back in New York City so I can watch the Patriots and Broncos at 4:30 tomorrow. So when I'm on the road that much, I do not have a primary care physician. I don't have it. My primary care physician is a company that is on the internet. Because in 15 minutes, no matter where I am in the United States, I go on my computer, I log in 15 minutes I have an emergency room doctor on video to me no matter where I am. And that doctor comes on and talks to me, I say what my issue is, and I get either referred to the local clinic or hospital, or he or she says, go and pick up your prescription at this place. And that's how I do it. I do not have time to call a doctor and say, can I see you tomorrow? Because most of the time I'm not home. You know, this is the public today. This is America. You know, this is, I want what I want when I want it, and I want it now. It's not, can I call you and meet you in a little while? So for places like Jacksonville, for people like me who want to be able to call up and say, hey, can I speak with you on such and such a time? With my schedule, with today's society, it's very hard for someone to meet the schedule. You know, you say, I'll see you every Wednesday at 4 o'clock. Well, okay. Well, every Wednesday at 4 o'clock I can't be there, but I could be there potentially by video. I could talk to you every Wednesday at 4 o'clock by video, no matter where I am in the world. And that's what's important to me as a consumer. That's what's important to me as a person. So companies like ours, we're not the only one in the business. By no means are we the only one in the business. What I have to say is, one of the most important things you have to think of first is security. Security is number one. The ability to assure your patient that you are secure in your communication. Meeting your HIPAA guidelines, making sure nothing is violated. Number two is making sure you have a quality of service. How many of you have ever used some...
That was 3. That's 2.
Oh. How many of you have ever used an online video thing? Right? Anybody ever see this? Or when you're talking, it's like 5 seconds later, the lips come through, right? How many people want to deliver service that way? Do any of you feel that that would be sufficient for what you want to do?
No.
Then don't do it. It's that simple. It's that simple. Don't do it. The telepsychiatry, the telepsychology. In fact, CHG Medical Group out of Maryland did a study in New Jersey and Pennsylvania, and they found that in jails that the cases of suicide decreased with the use of telepsychiatry. Decreased. Rather than in-person visits. Anybody want to venture into why? I guess? Yeah.
It feels anonymous. It feels more private, actually.
Right? Anonymous and private. Totally right. What else?
Thinking maybe more people have access to receiving services.
More people have access to receiving it?
It's fast. When the person's in distress, they get it immediately.
Right? Stress, fast, quick. And what age group? Oh, gee. How many here are like me, like around 52? Higher? Lower? Everybody's 29, right? People grow up with this stuff today. Look. This. Who has it?
Who doesn't have it?
Who doesn't have it? Kids grow up on this. You get the grandkids or the kids an iPad and they learn it in 30 seconds and it takes me 3 years. I may be in technology, but I don't understand a lot of this stuff. But they grew up on FaceTime. They grew up on Skype. They grew up on texting. This is how they've grown up. This is how they expect the world to be. And what are they when they're using that? They're very, very honest. Stupidly honest sometimes, right? But they're very honest. They're actually talking. They do not feel as though they're going to be physically in any way inhibited if they say something. So therefore, those people that are going into the jails today, you put them on video, they'll tell you anything you want to hear. You put some human being next to them, the defenses go up. It's a whole change. So, though technology in many ways people think is taking us away from our human element, in many ways on the medical side it's opening up our human element. It's allowing people to open up and being honest and being broad in the scope of things that we want to talk about. So I'm just here today to, number one, Frank has been very, very progressive in this area. Cisco, as a company, what we call the Internet of Things, changing how people live, work, and play. And there's all these little things that we can tack onto it. But the reality is we're a very, very big company, a global company. But sometimes it's necessary for those companies to do the right thing. So Cisco actually donated equipment to this organization here, Ethical Society, and also to a couple organizations in Brooklyn and the Bronx. And we put equipment in there so that they could start programs for families to do visitation to Rikers Island and to upstate prisons, and to be able to do Mother and Me, Father and Me programs for kids and incarcerated parents. It was like $80,000 worth of equipment, but we put that in there. And we put that in there, actually, the company had no intention of putting it in there, and then in there until they hired me. One of their biggest mistakes. They hired me, and I was like, this is what we need to do, boom, 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 boom. And they've done it all because they see that there's a community response to it. And they understand that this is a big thing. We're not healthcare providers. It's not what we do. We just have the conduit and the plumbing to help the healthcare provider to bring what they need to the patient. That's all we do. But we're a big company, and throwing a few units out was not going to kill us. Let's just put it plain and simple. But it was going to be something that actually we could look at and say, let's see how this works. Let's see how it works out. And more we're finding the benefits of this stuff. So when I'm out in Jacksonville, Florida, talking to the city saying, hey, you know what? Up in New York City, they did this. You could very easily do this in this building to get that service from the University of Florida Healthcare, or this or that. But then it's going to be the private providers, the availability. 15 minutes. I have an emergency room doctor on SwiftMD. Can I get one of you in 15 minutes? Can I get mine in 15 minutes? That's what I want to know, because I want it now. I don't want it tomorrow or in 3 weeks. I want it now because I'm hurting and I want it now. So hopefully this will be a really good conference. I have to be out of here at 1:15, so I'm going to shut up for right now and let the other speakers take it away. But I have to fly out to Seattle, do dinner, and fly back. But it's a pleasure to be here, and I'll stay as long as I can to take any questions I can. Thanks.
Good. So thank you, Dan. We do collaborate at Ethical on a couple of projects with Cisco that Dan has helped us with. One of them is the supportive televisiting services. There's a brochure, make sure everyone gets that. We're going to be beaming in live to the televisiting room that's upstairs, and where children come. And they come and they hang out with me, and their mom beams in from Rikers Island on a big screen TV. And they have a televisit together. And then we also have started doing, as of over the summer, we started launching library-based televisiting. So we partnered with the Brooklyn Public Library. And so a child who's in Brooklyn can go to the Brooklyn Library and use the equipment there and have their dad beam in from Rikers Island and have a visit. And we've also flipped the script. So my role is a lot of times I just pilot things, check them out, and then call my friends and quick, we can do this, we can do this. And so now the library is lighting up. Brooklyn's putting in 6 units.
16.
16. These people are fast. 16 units where people can, and that's like 3 different branches now.
They're going to expand to 60.
They're
Every
expanding
branch.
to every branch in Brooklyn. So that's library-based televisiting. So that's what the clinical psychologist perspective was able to do to build this program. And once you have televisiting, it's really just a step over until you have library-based telepsychology, where you could walk into your local library for your therapy, or for your assessment, or for your consultation. So once we start deploying these things, the next project we're looking at is church-based televisiting, where you can beam into the churches. So we work with the Black psychologists and Black psychiatrists of Greater New York to set up video units in churches. Because a lot of those folks are not going to look at me and be like, yeah, I'm going to talk to him. But they will go to their church. And we can start that connection there. So those are a couple of the projects that we really want to acknowledge Dan and Cisco for really helping us. Because he sees the vision. He sees what's going on. Not only in our industry, but everywhere else. And how to sort of, like, if we can invest a little bit of time and sort of tool ourselves and shift our culture, we can start creating these enormous opportunities. And so that's why I was so happy that he said yes when I invited him to be on the panel. The other thing I want to do, I want to have a quick hello from our other panelists, just sort of say who you are so people know who you are, and then I'll do maybe a 10 or 15 minute presentation to give you a couple of models to think about, because telepsychology is a very big word, and it means a lot of things. Generally, when I'm talking about it, I'm referring to live, secure video, and that's generally what I'm talking about. A lot of people already use phone stuff, So that's a very natural sort of, a lot of the stuff will be similar. But I want to give you a couple of models so that as we're getting questions and stuff, you'll be able to anchor it to something. But for now, I'd just like to have everyone say hello and who you are and why you're here. And then each one of you will also have an opportunity as we move forward to speak longer.
Hello everyone, my name is Madalina Sukala. I'm a doctor in psychology. I'm originally from Transylvania, which both explains my accent and makes me very popular around this time of the year. But I moved here in US to work at Mount Sinai. I'm doing research there. I work as a postdoctoral fellow there. And our main research involves psychological intervention for breast cancer patients, but in the past years, we are moving these psychological interventions to online interventions. So we are delivering them over the internet, text messaging, video conferencing, and you're going to hear a lot about the research behind that. I'm working mainly with breast cancer population, but because this is a general discussion, I'm going to keep my research or the data focused on the general population. So we're going to talk about depression, we're going to talk about anxiety, and everyone who has questions, specific questions about maybe something that interests them or their particular areas of interest in terms of what patients are they working with, I'm more than welcoming your questions.
I'm Dr. Sharon Batista. I'm a psychiatrist in private practice. In my other life, I'm a diversity officer at Mount Sinai Hospital. But I won't talk at all about that, though my work there works on health, workforce diversity issues, and mental health. We need more diversity there, of course. But I'm here because I'm really interested in technology. I use it whenever and wherever possible. And I actually took a training through